If a parent has this conversation and their child, their teen, reveals that they're suicidal or that they're suffering from symptoms of depression or anxiety or other things that are concerning, what should parents do?
So school is a good place to start if they feel comfortable talking to the professionals at the school, whether it's a mental health professional, the guidance counselor, but also talking to their pediatrician. That could be another great place to start. There are also a number of national resources that we'll have available at the end of the show that people can call to get help as well.
But I'll build on that. Absolutely, schools are a great place to start. In part because we have our own building-based staff that can support, and we're very fortunate in Boston to have a wide variety of partners that we can refer families to for special needs, linguistic needs, or specific needs. So there's resources out there, and that's what we really want to make sure that parents and students are aware of.
Right. I'll just echo that.
Sure.
I really believe that if you're worried about your kid, and you are thinking about, maybe they need to see someone or maybe to have some counseling, there often are school-based services, and sometimes schools don't have that too. So thinking about other districts or different resources based by school. So I do think the pediatrician is a huge place to start, and often now, pediatrician offices have behavioral health clinicians embedded in their practices, or they have referral networks and places that can really help families open that door. So I think, what I would say is try anywhere that you can as a parent. Go to the school, go to your pediatrician's office, and you'll start to build sort of your own network of resources and supports that you may lean on here and there.
And I would even add churches. I'm very active in my church, and we have a mental health wellness ministry, and so we get referrals for that place. So wherever there are places that you go, I think that's a place to start.
There are also, again, a lot of national resources, whether it's the Suicide Prevention Resource Center, hotlines available, Suicide Prevention Lifeline, other things to access, and being able to make outreach to those services if you really can't find anything else in your community, don't have a good relationship with your pediatrician. There are 24/7 available resources out there to start to build the supports.
Right. And I will say, as a last resort, having spent many years working in the emergency departments at local hospitals obviously are always there, and often have some kind of behavioral health person available to do an evaluation if needed.